It's Monday, the 21st day of December, and this is your Barbados Today Evening News Update. Health experts say there's no need to panic as investigations continue into new coronavirus strains that have been detected in the United Kingdom and South Africa. The PAHO WHO representative to Barbados and the Eastern Caribbean, Dr. Tadis Gibre, today explained that all viruses change over time. He stressed that so far, most changes to the virus have had little to no impact on how it transmits or the severity of disease it causes. He further noted that there is no evidence at this stage to suggest the COVID-19 vaccines currently being rolled out will not work across the country. The PAHO WHO official advises that citizens should stick to COVID-19 protocols to reduce the risk of transmission. These include wearing of masks, frequent hand washing, and avoiding close contact with people suffering from acute respiratory infections.
In the past few days, there have been reports of new variants of the COVID-19 virus in South Africa and the United Kingdom. Viruses mutate over time. That's natural and expected. The UK has reported that this new variant transmits more easily, but there is no evidence so far that it's more likely to cause severe disease or mortality. WHO is working with scientists to understand how these generic changes affect how the virus behaves. The bottom line is that we need to suppress transmission of all SARS-CoV-2 viruses as quickly as we can. The more we allow it to spread, the more opportunity it has to change.
At a news conference in Geneva today, the Director General of the WHO revealed that the international body is working with scientists to get a better understanding of the new strains of the virus.
There are a number of groups that continue to push a narrative that this virus only affects the old, and that with vaccines on the horizon, we can relax. COVID-19 affects children and adults in a variety of ways, and it can attack every system in the body. And a growing number of people suffer with long-term consequences of the virus. This includes neurological complications for children and adults, which are still being researched.
He also stressed the need for countries to double down on public health basics that have seen many countries suppress the spread of the disease. Here at home, on the heels of a reminder by Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic for citizens, businesses and hotels to keep their guard up at the height of the Christmas season, operators in the city give assurances that COVID-19 protocols are in place and being adhered to.
From the inception, when we reopened business due to COVID, all of our protocols were in place, and to date, in December, they're still running smoothly. We've had various visits from the COVID unit, and we've had compliments also from the COVID units. And just if there are any minor things to be done, we make the changes, but they were to the very, very minimal. In terms of managing the crowd, we have our security who actually make counts during the day, and we control the crowds in that aspect. When you enter the store, you're asked to remove your mask briefly. We sanitize your hands. The store is being sanitized periodically throughout the day. We have a custodian on duty who does that from the time we open until we close.
We have been monitoring persons coming in the store. Also, there's no one coming in the store that is not sanitized, is not having their temperature checked, and is not required to put on a mask. We've had some people who have refused to put on a mask, and they've been refused entry. We've had some people who refuse to be sprayed, and they've been refused entry. So to come in the store, you've got to have those three things. If not, you're not coming in the store.
So you're comfortable with your protocols that you have in place?
Yes, we're quite comfortable. We've had a steady. It's not like years gone by where there's madness in town, because COVID-19 has obviously had an effect on the economy. So we haven't had, where we've had too much people in the store at any one point in time. But all of our protocols that we've put in place, we have certainly, from the inception, have had them. And we've been very strict with them, and we'll continue to be strict with them.
We have been visited a few times by the COVID unit at both of our stores, and in most instances, we have done what we were asked to do, and we continue to ensure that our customers are socially spaced and they sanitize as they enter the stores. And of course, if we reach a maximum, we close the doors until customers come out, and then we let other customers come in. So we've been trying to adhere, and I must tell you, there's been great compliance with our customers.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news now in Guyana, the president of the Tourism and Hospitality Association, Mitra Ramkutar, has been making a strong case for bars and entertainment spots to reopen after 8 months of closure to help prevent the spread of COVID-19. More in this report from Newsroom Guyana.
President of the Tourism and Hospitality Association, Mitra Ramkumar, said the closure of bars and entertainment spots for over 8 months has caused a ripple effect, affecting the lives of families and employees, as well as the employer. A moratorium on loans was granted for up to 6 months by the banks in March and subsequently extended to the end of December 2020. Ramkumar explained that some of the entities will soon have to start repaying loans, even though they have not been in operation for months. As such, the association is calling on the National COVID-19 Task Force to allow for the reopening of these entities under strict COVID-19 protocols.
It is actually counterproductive if you don't open so that you have safe spaces. So you need to look at it from that perspective. So if you're talking about the reopening of bars, then what you need to do is ensure that that space or that bar that is going to be operated, the protocols are observed at that location. So you have to look at it from a holistic perspective. So it's not only at a small bar, it has a chain reaction. So it affects the banks, it affects employees, it affects families. All of these things need to take it into consideration. So if you look at it from that perspective, what you need to focus on is ensure that the operation of that facility is being done in a safe way, observing the same protocols that every other industry observes.
On the international scene, at least 17 countries have banned travel to the UK over fears of a new coronavirus strain that has been described by Prime Minister Boris Johnson as a danger to the country.
The UK authorities that you saw, Matt Hancock, have been categoric. For them, this new strain of the coronavirus is out of control. What is the threat that's being posed by this strain?
I suppose the first thing to say is that all viruses mutate. That's what they do. It's part of the normal evolution of a virus. As for details about just how virulent this particular mutation of this virus is, we don't really have a lot of information yet. It's still with the scientists. They're still working on it. But it does seem that the biggest threat is more easily transmitted. 70%, as you heard in that report, more easily transmitted. Not more virulent, though, as I said, and no evidence at all at this stage that the vaccinations being rolled out at the moment in all their different forms will be any less effective with this mutation than the existing one. So on that score, no particular cause for alarm, although the language being used by Matt Hancock, the British Secretary for Health, was certainly alarming, talking about a mutant strain that was out of control and had to be brought under control. That's scary language, and it's part, I suspect, is being used to try and shock the British public into taking a more responsible attitude towards the virus and looking after themselves and those around them.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.